Assalamu alaikum, Dr. Nader.
Alaikum assalam wa rahmatullah.
How are you?
Very good, alhamdulillah. How are you?
Alhamdulillah, shukrillah. Good to see you again, all of you.
Yeah.
Assalamu alaikum, Shima, Muhammad Ibrahim, كيفكم?
السلام بابا كيف حالك؟
Alhamdulillah, shukrillah. Congratulations, Muhammad. I didn't know.
أنا جات لي زي أسبوعين كده.
Yeah, والله ألف مبروك، ألف مبروك.
Alhamdulillah.
How is it going?
With so many paperworks.
Oh yeah, tell me about it. My apologies, Dr. Nader. يعني I didn't follow my emails and I've seen a lot of things coming in, but
That's all right. That's okay.
yeah, I didn't get the time to get back to you, but
Yeah.
hopefully
You went
within
to
that.
Saudi Arabia? How is it?
Yeah, I returned. Yeah, I returned back. I didn't know that a lot of things need like for me to be like in the States to do them. And I'm glad I enjoyed my vacation though. But when I came back, it's everything on. I have to run and finish it on time. So that what kept me busy. But alhamdulillah, things are going good.
Good.
How are you, Shema? Are you in the States yet or? I don't think she's muted. Yeah.
Mohammed, did you finish the paperwork or still working on it?
I have a hard time to hear you. Sorry, Dr. Nader.
Did you finish paperwork?
Yeah, mostly. It's almost like I sent all the papers required by the board. The board of Ifada is a little bit like it's still using the paperwork which should be sent or mailed from my medical schools, and even the observerships I did, they have to be verified by letters from the clinics where I worked.
Yeah.
And yeah, but I think I did like 95% of all the work that should be done.
That's good. That's good. Yeah, I think for fellowship, they are more vigilant in digging into your background and your experiences rather than residency. I think this year, even for the transcript for our program, they just like said they can send it by the email since of COVID and restriction and everything. So the mail hustle part with Sudan is at least lifted over our shoulders. So better. Yeah, alhamdulillah, shukrillah.
When is the orientation for you guys?
My orientation start on June 20th.
Mine is 21st. Yeah.
And then before the actual stuff.
I'm still looking for a place to rent and to move. It's a big move from Michigan to Nevada. Yeah, it's a big move with the family.
Yeah.
But inshallah, everything will
Hopefully,
be fine.
I'm still in that hustle too.
Yeah.
Because of like the family, as you said, like finding good schools and stuff like that is really challenging. And currently, I think the market is really very tough for houses, even for rent. Yeah, I hear that people selling their houses because there is a lot of growth and they have like a lot of revenue from their houses. So they are selling their houses and searching for rent as well. So it's really tough.
Yeah, New York is too expensive.
Your voice went away. We're missing. Is it the mic?
Hello?
Hello? Yeah. Maybe it's the mic.
Oh, my connection, as usual. I forgot.
Oh, that's all right.
I connected to the thing.
We can hear you now.
Okay. I was saying,
Lubaba first. Hello, Krupa. Welcome. You're muted.
Hi, Kroba, you are mute.
I'm so sorry. Hi, Dr. Nader. How are you?
Very good. Thanks. How are you?
I'm good. I'm good. How are you, Mohammed?
I'm good. How about yourself?
I'm good.
Congratulations. Hi, Shema. So how about you, Shema and Patel? Krupa, when are you going to start the orientation?
My residency starts July 1st and the orientation starts June 27 on the Monday.
Oh, so only 3 days for preparation?
Yeah, I don't know. Some people started like 2 weeks ahead, but mine is like the very end. So I don't know.
Okay. They know you know everything, so they just,
I think this is a good sign that, yeah.
I know. Honestly, the vacation went by so fast and I wish we had extra time.
What do you say, Matt?
Yeah, same rotations will start in July 1st and the orientation 1 week before.
Oh, good.
Yeah. So same scenario.
Yeah. Just give me 1 second.
Hello, Krupa. Sorry, I had a bad connection earlier.
Hi, Lubaba. Are you ready to go to New York?
Not yet. How about you?
I'm going to Delaware. I'm still in New Jersey, but I found an apartment. So hopefully moving in will happen in the next 2 weeks.
Okay, congratulations. You're moving close by, like 1 hour or 1 hour and a half?
It's about 2 hours.
Okay.
But still 2 hours going there, 2 hours coming back. And with the gas prices right now, it's so expensive.
I can't agree more.
Yeah.
Yeah. That's a short move.
It's a short move, yeah.
Yeah. Muhammad's move is really big. For me, 6 hours.
Oh, that is big, yeah.
Yeah.
I need 3 days driving to there.
Wait, where are you going, Mohammed?
Nevada from Michigan.
Nevada. Okay, yeah. So you should probably are you going to drive or are you going to fly there?
I'm fortunate to drive.
Drive, okay.
But I think driving in the summer is really fun. I really like road trips. So yeah, 3 days might be a long drive.
I mean, but with like $5 gas prices, I don't know.
Even the flight price now is too high. Like
Exactly.
Yeah, yeah.
we are a family of 6, so yeah,
Mashallah.
a big problem.
Where are you going, Shema?
I'm going to Oklahoma City, inshallah.
Where are you going?
To Oklahoma City.
Oklahoma City. Okay, okay.
Yeah, but I'm still in the UAE. So yeah, this is a
God.
big move now.
Yeah. You have your things all settled here, or you still have some work to do?
It's still like the paperwork for the license, something like this. But almost I submitted almost all the papers. And searching for apartment as well.
Wow, everyone.
Yeah.
Yeah.
I didn't think that it would be like this. It's a big hassle, but inshallah.
The onboarding was so hard. It was like one after another, after another, after another. It's just never ending.
Yep. Yep.
Yeah. And time is just passing so fast.
I know. I wish we can go back to March again.
Yeah. Hopefully for the best, inshallah.
Dr. Nader, what advice do you have for us? Are we going to have 80-hour weeks like, for residency?
So I think just plan by cases. The more you find every day a case that's unique, try to study about it and prepare for next. And yeah, the first year usually it's very tough. It's very hectic. will be very, very busy. Then second year, you'll be a little bit relaxed and you'll have time to do what you want. So try to take it easy first year. It's easy for me to say, but just look at the second year, look forward.
The process of onboarding and everything that we're doing now, was it the same in your days back then? Or
What do you say? What do you mean by onboarding right now when you say that?
So for me, it's like the GME part, they have their own paperwork and their own processes. The department itself, it has their own stuff as well, which would be like papers, could be, I would say roughly 15 something that you need to fill and sign. In addition to that, I'm going to be trained in a VA hospital. So that is another process for me. It's like doing federal government stuff and going there doing fingerprints with all of these kind of high top security. I was like, oh my God, this is reminding me of the citizenship and everything. So it was really like a lot of every kind of department, they have their own processes. So this is what I meant, like.
Yeah, so for us, it was more or less similar, but I don't think it's as much paperwork
As now.
Again, I think it depends on how many hospitals, what the system you are getting in. When I started in a small community hospital. So for me, it wasn't as hectic. But when I came to Michigan, then I was MSU, and then the hospital itself is different. And then when you go to other hospitals, it's same. So, and then I worked during the summer in rural hospital like low cancer, Moonlighting. So it's also the same. So everywhere you will have the paperwork.
Yeah. Maybe because of COVID and they're trying to do everything like online and do most of it.
Yeah.
And they added to the volume of what we used to be done.
Bob, are you done with the 188-page module of the VA?
Oh my God, I didn't even hear about it. I think this is they tell us in the orientation maybe about it. It's a really big packet that I had to do, like when I came back, and part of it like doing fingerprints and sending all of these paperworks. But no, I didn't know about that.
So, I did it last week. Yes, I sat for that for 2 days, consecutive 2 days for the VA paperwork, and then I did the fingerprint at the Young VA Health Center in Detroit.
Okay, yeah. And emails are still coming like, you forgot that, we are still waiting for this.
Yeah, and deadlines and all this.
Yeah, exactly. Exactly.
Did you guys have to go for BLS, ACLS training?
I'm registered for it. I'm going to do ACLS on the 23rd.
Okay.
Yeah.
Is that during orientation or before orientation?
So I have the department orientation on the 21st and the GME from 24th to the 30th. So it's between the orientation. Yeah.
Okay. I have to go Monday just for BLS, ACLS. I'm driving 2 hours there, 2 hours back just to do that training.
Good luck.
Thank you.
I think other fellows may be confused by the time I sent. How is the new group going, Dr. Nader?
It's a bigger group, but it's going well so far. So we are trying to organize things and get the ball rolling. But we are getting into the system.
Great. I've seen a lot of posts from our colleague that presented in other conferences, and this is really great.
Yeah, it's going well.
Yeah, Dr. Ala, I saw, and I think Lena. Yeah, and Selma and all of those.
How
A
many
lot of-
people? How many people are in the new group, Dr. Nader?
Around 100.
Oh wow!
So, yes. So
So you might have to write 100 letters of recommendation. That is crazy.
But I think Dr. Nader is a tech savvy, so he's like, this will be like done in 1 hour or so.
I'm talking about the paperwork.
Exactly. Yeah. Wow. So 100, wow, this is a lot. So subgroups are in like 10 people each.
So about maybe more than 10, maybe 14 in the group. So I told them to divide into subgroup, like each team, they would have team A and team B, two groups, and then they can arrange between them for presentation and other tasks. We'll see how it goes. If it's too much, we're gonna just try.
But this is really great effort from you. Thank you so much.
Do
I
you have
think
a,
the
do
first,
you have a cap? Like how many people you can have at like the most?
What's that? Sorry.
Do you have like a cap, like the maximum amount, but from the, like from Michigan State, do they give you like a limit?
No, actually, it's because it's online.
Okay.
My target was 100.
Mhm.
Actually, less than that, but I had a lot of people who are applying this year, and I didn't have the gut to say no, so it kept adding up, and I'm like, okay, by now I'm supposed to stop.
Yeah.
Hopefully, it will help some.
It definitely helped all of us.
Sure.
in March. Yeah.
Absolutely. Yeah. Yeah. It's really had a big difference in our application.
Yeah. I was asked about it on a few interviews specifically, like, you know, about what I do here.
I'm very glad.
Yeah.
It helped. So, and I need your help. So, talking about this newcomer. So, in the
Yeah,
future,
no
maybe,
problem.
yeah, when you have some weekends that you think you are relaxed and not as much, maybe you can just jump in or let me know whatever you think you can help you.
For sure.
Yeah, definitely. Sure. Yeah.
Sure.
So I have some interest in psych, some interest in pathology, some interest in GI. So we have different things going on.
Diverse group. Good. Good.
I know Lubaba is going to IM, right? Shema and Mohammed, where are you guys going? What specialty?
Pediatrics.
Pediatrics?
Geriatrics.
Oh, geriatrics. Okay, okay. And Shema?
Pathology.
Oh, great. Yeah, so you have a diverse group to work with, like some going to fellowship, so you can, you know, give a guide about that route, and then also some of us internal medicine, psychiatry, pathology.
It will be fun to have your feedback and
Yeah.
yeah.
And we would love to help you know, the people in the group.
Thank you so much. I really appreciate it. So, Lubaba, do you know anyone who's coming in the WhatsApp group? Or?
As they're supposed to be, I think the 1 p.m. kind of.
Yeah, that might have thrown people off.
Yeah.
Oh,
Someone just replied. Oh, so far, Sarah on flight.
oh,
Sarah Mohammed Osman, yeah. To join, but it seems very difficult. At least that Dr. Nadir know.
that's fine.
Yeah.
That's all right.
She was in Sudan.
Okay.
Who is this? Sarah Al Sayed? Sarah?
Sarah Osman. Sarah.
Oh, Usman. Okay. Because we got a good response. So, you know,
Yeah,
I think people
yeah.
might have just forgot the timing.
Yes. Maybe they're gonna join with the new group.
Yeah, I think the time
Yeah, yeah.
Maybe they got a little bit confused.
I don't think someone replied to your email, Muhammad, right? When you said it's 1 p.m.
Yeah, nobody replied. Yeah.
I was on the road myself and I'm like, the meeting is today. I thought it was like 4 p.m. and then I was like rushing home. And I was like, okay, a few minutes late is okay.
So perhaps I can ask everyone here, maybe if you want to give me a feedback about what went good for you guys during this year and what went like that can be improved in the last year or couple of years of the fellowship. When you came in, when you started, what was your expectation? And what seems to meet some of the expectation and what you thought maybe to be there, but it happened. Okay.
Maybe you guys start first because I spent 2 years, so Dr. Nadi knows my feedback. But yeah, because maybe I've seen the difference between the first year and the second year. So if you want to go first, that's fine.
I have to think about it. So I'm actually actively thinking right now.
So, Dr. Nadi, can you repeat the question again, please?
So usually what I do is here at MSU, like every semester course, we ask the student to have a reflection about the class or the course they take, what seems to be working well, and what the expectation, what did they do, and then what they thought might be area for improvement. For instance, if they were assigned to different places, maybe they want to be like one place instead of spending the time traveling from one place to another, or some other feedback that might change the way we teach. So for you guys, when you started the fellowship, I assume you have some expectation, you want to do something or you want to learn something, or and then when you started, maybe you achieved your goal, you met the need that you wanted or the expectation, or some of them might not be as complete as you wished for. What area you thought maybe you will face and meet and achieve, and then you started, you finished, and it didn't happen. That we can improve on, for example. If I make myself clear. So what's the positive, what's the negative?
Okay, so one of the positives definitely is that, like, you really try to call everyone and keep in touch and see their progress. And I think one of the things that we can improve on is, how we split it into groups. I think since now you have 2 years of people that have matched, so for the next year, maybe you can get us on as mentors, right? For example, so if there's like a group of 10 people, you will have like a previous person, and I'm sure people would be willing to volunteer their time so that as the season goes along, I know we'd get busy with residency too, but if there's a WhatsApp group and they have questions, then we can always like kind of guide them on the ERAS part of, or the application part of the cycle. And yeah, I think that would be a positive. Like, for example, I know we have people like with psychiatry, pathology. So if you could split the groups into that kind of way. And then for psychiatry, like you could have me there. And then for internal medicine, you could have Lubaba, and pathology people, Shema, so that we can serve as mentors to these people. And if they have any questions, guide them to the, like, whatever our time allows, basically. That would be one, I think, improvement we can make. And I'll think about it. Anyone else interrupt?
That's a great idea, actually.
That's a great, yeah.
I think I wrote down the survey that you have sent before, like 2 or 3 months ago. Also, I suggest that if it's applicable, if you can have a guest at least once a month, who is expert in a specific part of the research publication, like biostatisticians, like something like that. It would be more helpful too.
Thank you.
And also, I think if we can like split it up, I mean, I was busy with step 3, so I wasn't always there at the meetings, but if we can split it up into like case reports and like how to write a case report, and that would be like, you know, maybe 2 meetings just focused on case reports, and then another meeting focused on systemic reviews. And then like, so we do it in that way. I don't know how much like data analysis stuff that all of us have used, but like, I think the writing part would be very important. And then we can find ideas and actually take it, not just abstract, but take it to a manuscript form.
Sure. Sounds good. That's really great. Thank you.
Oh, for me, my feedback, actually, my goal when I joined the fellowship is to apply what I had from the master. And to that point, I really fulfilled that goal. And it helped me a lot in leadership kind of qualities and stuff like that. It really was the fellowship that instilled this on me and helped me a lot in this area. The thing that when I came in, coming from the master, I was expecting kind of curriculum or some assignments due or stuff like that. I should do them, but in that area was not. So, but the way that we carried the first year, it was really good for me to learn, applying things. For example, as she mentioned, we presented about case report, systemic review, and we applied those in doing the research and the abstract. I agree, we all planned for manuscripts, but we haven't, we have only 2, I think we submitted, but we didn't work on that area a lot. So the second year, I think we were more also focused on the research and how people to do the research as well, but there is no, I think previously we talked about you need to be really tough with us so we can, everyone can be involved and have like deadlines and follow them. The first year we were like chatting in our group and pushing ourselves, we have to do this and we have to meet this, but you were very kind and calm in the way that you are not pushing us for deadlines. I feel like still this area need to be like really more strict, so all of the people will be involved and in all research, and at least everyone has at least 1 or 2 abstract or something that their name included. And in the area of the presentation in conferences and meetings, I think we did a lot of a great job in that area. The program, a lot of people, they don't have the experience, they don't have the knowledge, they don't have anything, but at the end of the year, they have presented, at least attended a lot of good national kind of meetings and international, although also as Krupa she did for psychiatry. So the area, I really support the idea of that mentorship for the application season. I think the area of the application and how to prepare for the application and interviews and all of these skills, we did a great job during the first year and the second year. People were very focused and they are very involved, and everyone is trying to put whatever they learned about this. And we had some people from the first year come and join, like Dr. Mulham. And I agree with Dr. Krupa's suggestion that we can like pump it up to be a mentor actually for those new fellows. I think, but in general, the fellowship is really, I don't know how to say it in English. Atat ukluha. I don't know, translate it for Krupa, please. It's like we got the fruit of what we aimed for, I think. I don't know. So, but thank you so much. Yeah, we can't really give you our gratitude or our how we feel about what you did to us and how you paved the way for us. It's really, words are not enough, but you did a great job and you're still doing it. So
thank you. I think you did the whole work I just thought, but really appreciate the input and feedback. It's important to know what areas what we can do, what we benefit from, and how we can improve that. And yeah, so excellent. I'm very glad for you guys.
And guys, we have we don't forget that the friendly personality and easygoing personality of Dr. Nadir.
Yeah.
Sure, of course,
Yeah, maybe
Yeah.
it's
Else,
90% of the success of this fellowship.
absolutely, absolutely.
Thank you.
Hopefully we can follow your footprints and try to give for people the same way you did for us.
Hopefully, I'll take you accountable for that, so I don't promise. So one idea when I started that is I thought that might be something in the future. But in India, there was a girl who started working with, I think, students like 1, 2, 3 with disabilities. So she was involved on music and dancing, and so it's just to increase the engagement of this population in school and so forth. And she started with one school, and then she started to teach the teachers about this, and she went to the second school and third school. So it's kind of trained the trainers for some of these, and it went like snowballing in different directions. So my thinking is maybe to do the same with you guys, and when in the future, in a couple of years, when you are, let's say, attending, and maybe you can start the same idea of scholarship in different areas, let's say, like open side, in pathology. And then you can start your own, you can help some of the people in this situation just overcome. It's just the hassle of getting into the residency, but how to get there, how to get equipped for the future in that area. So hopefully some of you might be able to help keep that going.
Inshallah.
Inshallah. Yeah.
So I'll get in touch with Mohan and the other people, Marwan and the first group who now they will be in the second year of residency. They'll be a little bit less busy. Hopefully they will have some time to help and see what they can do. And then I'll give you 1 year to spend in the residency or fellowship, and then I will come back to you guys.
That's a good plan. Yeah.
Yeah, don't hesitate. Yeah, yeah.
Anything else we as a group can improve and how we can, as far as organization, team, product teams, and any areas that did go well for you, didn't go well.
I support what my colleague had mentioned 100%. And in my mind was what Gruba actually mentioned, which is focusing on one type of, for example, for a type of research, and then we try to conduct that type of research. Actually, the tips and tricks that I learned from this fellowship in terms of the research and leadership, the interview tips and tricks, it was amazing, and it was really very helpful, and it gave us like the push during the researches and the interview. This is one comment. The second comment is also like a question. If applicable, I don't know if it's possible, because I know there is a grand rounds that the fellow attend in internal medicine. So recently, I mean, if I'm talking about pathology, with COVID, they shifted somehow to the digital pathology, because it's a slide, like they can do it online. And even for the residents at the peak of the COVID, they were studying and they were discussing the cases online. So if there is any possibility, for example, also to have such type of rounds for the maybe connection with other departments for the residents, then also this would be great. Will add to their CV a lot.
This is great. Thank you so much for opening this door. Maybe I can ask you guys when you join, most likely you have your own grand rounds. Let's over your group and fight. If it is provided online, can you ask them if some of the fellowship who are interested to join? Because I know some are interested in neurology, and I have access to neurology at MCO. So I will give the link for them and say again. And then I will set the grand round in internal medicine. I'm trying to see other, especially your other grand rounds. There is one in online from Utah, with the university, but I couldn't get the link working for it, so I couldn't get it. Maybe when I'm start your pediatric fellowship, maybe you can access some of the grand round if there is one, if they allow to get. Because as you said, some of these will be open to not to the public, but maybe to the learners in the area.
Dr. Nader, do you also see patients like clinically, or are you just in?
Yeah, my practice, I see patients in nursing homes, so I go to 4 nursing homes now.
Okay.
And my group covers 5 nursing homes. So some of us, they have clinics, some of us, we used to go to the hospital. We have the consult service, but we stopped. Our group was big, but it got divided into the small groups. So my small group will be focused on the nursing homes. Maybe,
Would you have any interesting cases? Because then what you can do is just assign like one of the cases to each group. So during the case reports time, they can each write a case report on one of your patients.
Oh, maybe, yeah, that might be good.
Yeah. Because as a student, like we didn't have access to patients. So I also did research at Newbridge Medical Center in Paramus because they have a psychiatry program there. So I had done research, and how they did it was the residents, they would find their own, like they would have patients and they would give me the data. And then based on that data, I would write an abstract and then I submit it to the APA. And then the resident would have their first authorship and then I wrote it. So I would have second, and then the attending would have third authorship. So that helped a lot because, I don't have access to, I mean, I did have access to patients through my externships, but this was like an interesting case that they would present to me and then I'd write it up. So if you have an interesting case, since you're at the nursing home and that is geriatrics, I think if we assigned it to each group, one case for each group throughout the year, then they can at least write up that one case report. And then that can be submitted to some, like you can do a full case report or you can even do an abstract on that. Yeah.
I think it's a good idea. Great idea.
We did one in the first year, right? We did one of the cases, yeah.
Okay. Yeah.
Because I know with geriatrics, sometimes there's also neurology related because they have like Alzheimer's, but then you can also have like a psychiatric component because sometimes they have people with Alzheimer's coming in with psychotic features as well. And so you can always form some kind of case. And also with geriatrics, there's so many things going on that you can even kind of write something related to internal medicine. So I think that would apply to like every single group. I'm sure we can find one case.
I think it's a great idea. One of the ideas I had when I started the fellowship, more or less similar to what you did. My thinking, I finished in general medicine here at MSU, and then I joined the geriatric, which is located at the family medicine department. So I'm like working with family physicians who they have their own residency in family medicine. And I lost contact with my internal medicine fellows, like folks, but I see them through times, like in the down to here and there. And my idea at the time is if I talk to them about the same what you just mentioned, if the residents are having good cases, and I know most of the residents might be busy, so they have the material, but they don't have the time to work on getting the literature, putting all things together. So my thinking is if I can connect some of the fellows with the residents and work on the project like this.
Yeah, I think
that might be.
That is what the place where I was at Newbridge was doing. Like the residents would all find their cases, and then they had like a research group of certain people, like applicants like myself, and they would just assign, you know, like you do this one, you do this one, you do this one. And then through that, the organization, that Newbridge Medical Center, ends up getting like 20, like they get a good amount of abstracts into APA.
Yeah. I think it's a great idea. It's just how can I don't have a lot of connections, but I think we can start something like that with internal medicine, at least, or medicine,
or even if it's just geriatrics related, like if you know of colleagues that might have cases, you might have cases, then, you know, putting in one of your colleagues, you could just put them into the publication, but that would just give the fellows access to the cases itself.
Yeah, sounds good. And I spoke to one more area. I spoke to Rayan, and I showed him what you did guys in the last year. A lot of publication there. So he was thinking maybe you can turn most of this abstract into papers.
Yeah.
So I told him I will try to organize some of the new fellows to work on this. So my thinking is how can we teach them the basics of writing a manuscript? So in the next couple of weeks, we're going to work on that. And if some of them are interested, so the topics are there, the abstracts are there. It's just a matter of how can they go into the literature and get all this information together and try to digest later. So I don't think that most of the time the idea or the question, the research or information, as you said, the case is the problem. That as long as you can find that, the rest will become easier if you have time or you have manpower.
Yeah, just like we wrote the abstract with Marion, Indiana. And with the whole gun violence happening right now, I was just thinking, I was like, oh man, like we saw increased gun violence in those 2 years as well. So that could have easily been something written on gun violence, but we, and that opportunity still is there because it's not too late. So I think that I might resume that if I can figure out the timing. If not, though, someone else can resume it because the data's there. Because we had like increase in drug overdoses, but we also had that increase of gun violence, and that had the data as well in terms of like the racial data. So we can go into the racial and then the age groups as well.
Interesting, but thank you so much. Your feedback.
Great ideas.
So I'd like to congratulate you all for completing your projects and enjoying your presence, your feedback, your involvement. I think it would be great. Every one of you deserve the best, and I wish you all the best when you start your residency or your program, fellowship, or other.
So we have 2 people that joined.
I think there's a new.
This is the new.
Oh, okay.
They are so enthusiastic, like
yeah.
Good.
Thank you so much, Dr. Nader. It really, really made such a difference, though. Yeah, it was crucial for, I think, matching for me, for sure.
I'm very glad that we can do that.
Yeah, and then the university affiliation, like Michigan State University, that really, really helps, you know, like having that academic affiliation. So
I can't agree more. I used it in the emails when I sent for interviews. Big thing. Everyone is replying, even like if they're not interested in my application, they will say, okay, apply for us next year, especially for fellowship. When I was seeking fellowship, the only big thing that I put in the subject with really big, bold letters, like MSU fellows. Yeah, it's really great, the opportunity. We really can't thank you enough about it.
Oh, thank you all.
And I think that just because a lot of people are matching into geriatrics, like Dr. Ibrahim, and also today, Dr. Al-Safi messaged me, he matched into geriatric fellowship.
Oh, that's
did? Why?
Yeah.
Oh, congratulations.
So he matched in Pennsylvania. And so, you know, I think that goes to tell you that, you know, this is a huge deal because people are actually matching into an accredited paid fellowship.
Exactly.
And then from there, you can go into internal medicine very easily. You know, it's a little bit untraditional, but it works out quite well.
Yeah, I'm very glad. That's good news.
Yeah.
Good news. Yeah, I know he struggled while he had a lot of opportunities and they were turned down after his hope was really high. But
yeah,
this is good news. This is really good news. Yeah.
I'm sure he'll tell you I kind of just, you know, volunteered the information a little early, but yeah, I just heard like an hour ago. So I was like, wow, very good.
No, that's a good spoiler. We want to hear that. It's really great.
This is great, yeah.
Yeah.
And when we started this fellowship, we didn't think about the fellows, the fellowship programs. And I think as I started with the fellowship, Khalid was talking about fellowship program.
Yeah. So they're doing it like, you know, fellowship first, then they'll apply. I'm sure Dr. Ibrahim will do the same thing, like apply into the residency. But sometimes what happens is if they have the fellowship, they'll absorb the people for IM straight from there. So you do geriatrics and then if they have an IM residency, they'll just take you the next year. Yeah.
Hopefully it will be easy for Muhammad and Asjad
And Wail, yeah.
Asjad,
Yeah.
That's good.
He's doing nephrology.
Yeah, in Michigan there was a program for fellowship similar to that, but for some reason I think they stopped it. I'm not sure.
Yeah, they closed it, I think. Yeah, one of the Sudanese people were there.
Program director. What's her name?
Oh, I don't know the program director, but one of our colleagues, he did 1 year there, and he was the last fellow in the geriatric fellowship, and they closed it after that.
Yeah.
That is such a horrible thing because there's such a shortage of geriatricians and geriatric psychiatrists. And I don't know why people are not doing it. It might be the whole Medicare situation, you know, the pay, but there is such like, you know, we're not even thinking about elderly care in this country as much as we should be. So even in psychiatry, you know, like geriatric psychiatrists, there's such a shortage because everyone wants to do child and adolescent. Everyone wants to focus on the younger people.
Yeah, right. So welcome the new guys who joined later. Dr. Ibrahim Arid, Al-Batay is here, and someone else. So in a couple of minutes we will start another group, but for you guys, I wish you all the best. I wish you all good first year for you guys. I know it's gonna be hard, but good for you, and I want to be in touch when you get a chance. Maybe you can send me an update. Just let us know how you're doing. Just keep us updated. If anything we can help you with, let us know. Hopefully if you have time, maybe we will use the idea of Lupa. With some of the new fellows to see if they have questions you can answer on the free time. It's been a great pleasure to work with you in the last 1 year or 2 years. I wish you
Baba.
The veterans are here.
Any final words that you want to share? And I know you are busy. If you want to stay with the next group, I'm happy to have you guys. But if you have any other programs or another, I know you have paperwork for other stuff. Don't you have any final words to share?
Yeah, thank you so much, Dr. Nader. Really, this is a great opportunity, and actually, we can't thank you enough for this opportunity and for your support. We are really proud that we were like part of this fellowship. So thank you so much.
Yeah, thank you again, Dr. Nader. Thank you so much. I think without this geriatric research fellowship, I wouldn't be accepted in the geriatric fellowship that now I've been accepted. So thank you very much.
Thank you. Thank you so much, Dr. Nader. As we said, we cannot express our gratitude or thankfulness for you. And I really owe this matching for your help. So thank you so much. I appreciate everything you did and you continue to do. And we hope one day we will be doing the same for our colleagues. And please don't hesitate to email us, despite that we sometimes respond after many days, but definitely we will be in touch. And I still have a project with other people still there, so I will be in touch definitely. Thank you so much.
No worries. Thank you so much.
Thank you so much, Dr. Nader. I mean, I would also not be able to match without your help because, you know, my program director asked about this Michigan State University research thing and I actually told him about you and he was very amazed. So, you know, just thank you. And for the support and, you know, I think for the moral support, whenever you gave a call and you asked how we were doing and, you know, you made yourself available and for writing the letter of recommendation, like everything just came together really well. So thank you, Dr. Nader.
I'm very, very glad. And thank you so much, all of you. And those who didn't join also, just pass my thanks and wishes for all of them. I think we did great. I think we did the whole work and we collaborate, we work hard. And we achieved what we thought maybe our goals and you enter into residency or fellowship, but the next step is to improve on your career.
And we'll always be, I mean, we'll always be available whenever you need us. A year from now, 2 years from now, 3 years, whenever you need us, just email us and we'll make ourselves available.
So look forward to my emails, then I'll take the word for it.
Inshallah.
Okay, thank you. Bye.
Thank you, everyone. Thank you. Have a wonderful day.
Thank you so much.
Night.
Thank you. Have a nice weekend.
Bye.
Thank you. And,
Bye, guys.
I will call you
Bye-bye.
this evening, Dr. Nader.
What's that?
Okay, everyone. Bye-bye.
I will call you this evening.
Oh, sure. Please.
Yeah.
Yeah. Thank you, everyone. Have
Okay.
a nice, good day. Thank you.
Bye.
Assalamu alaikum.
Assalamu alaikum.
السلام عليكم.
Assalamu alaikum. Hi, everyone.
Good afternoon, Dr. Nader.
Good afternoon, good morning, good evening, wherever you are.
Assalamu alaikum.
Hi, everyone. So we're gonna start in a couple of minutes. I'm gonna just share the screen for the agenda.
Good afternoon, everyone. Good afternoon, Dr. Nader. Rasha
So,
speaking.
good afternoon. Hello.
Hello everyone, good afternoon, Dr. Nader, good afternoon everyone. It's Abu Zar.
Hello, Dr. Akhtar. Hello, everyone. Good afternoon. So hello everyone, welcome to the meeting, and I think we will have a very productive meeting. Thanks for joining. So today we're going to talk about different topics. Hopefully the presenters are ready.
Assalamu alaikum. I'm ready, Dr. Nader. My name is Asjad and Rasha.
Welcome, yes, and I think we will be with Russia. Is that correct? So our main topic, or the first one, will be incontinence. That will be presented by Dr. Asjad and Rasha. Then we will follow up with some other topics, including how to present the topic, like public speaking. The second one will be Microsoft PowerPoint, the coach, how to use this tool with some demo. And then we will touch base on evidence-based practice and see some of the information from that object. So without you, if you are ready, ask it question, please take the lead and welcome. I think Dr. Abbas will lead the meeting when she joins. Thank you.
You have to share my screen.
Go ahead. Go ahead.
Do you see my screen, everyone?
No,
Yes.
can you? Oh.
You see it? No?
No, I cannot see.
No, not yet. Yeah. No.
Now you see it, or?
Yes.
Yes. Bismillahirrahmanirrahim. Today we speak about urinary incontinence, presented by me and my colleague, Dr. Rasha. We have a key point to take from this lecture is that lower urinary tract symptom is prevalent among the elderly, and patients rarely bring it up, and doctors rarely ask. Both the patient and doctors typically dismiss it as a natural aging. Lots are morbid, expensive, and have a negative impact in quality of life. The vast majority of patients can be assessed. What the objectives? To recognize the change in lower urinary tract comes with age, and recognize the particular feature of geriatric voiding issues, differentiate between the many types of incontinence, and recognize how non-urinary conditions affect continence. Physiologic change in lower urinary tract function associated with aging. We have some things that decreases and some are increased. We have decrease in urinary flow rate and decrease in speed of contraction, in collagen, and maximum bladder capacity, functional bladder capacity decrease, and sensation of filling is decreased too. Increase in post-void residual volume of urine, and increase in urinary frequency and outflow tract obstruction, and that occurs only in men. The definition of UI is involuntary loss of urine, generally in undesirable place, creating a social and hygienic problem. Prevalence increases with age, and women are affected more than men. The ratio is 2:1 until they reach the age of 80. 15 to 30% of community residents are 65 and older. In long-term care, 60 to 70% of older persons age 65 and beyond has a significant negative impact on one's quality of life. The underlying causes of UI is stress. We divide it to 5 major types. That is stress incontinence, urge urinary incontinence, mixed urinary incontinence, and functional incontinence, and nocturnal anuresis. Stress incontinence is leakage associated with coughing, sneezing, laughing, and physical activity, and it is the second most common form in women, seen in men after prostatectomy. Urge incontinence. Urge urinary incontinence with withdrawal of overactivity and inhibited bladder contraction. 40% or on urodynamic testing suggests withdrawal of overactivity plus impaired compensatory mechanisms. It is idiopathic age-related secondary to lesion in cerebral and spinal pathway due to bladder outflow, outlet obstruction, or bladder irritation that occur by infection or stone or tumor. The mixed incontinence, it's a mix between the urge incontinence and stress incontinence, mixed with both withdrawal of overactivity and impaired sphincter support. Leakage occur with both urgency and activity, mostly seen in women. Functional incontinence is a functional incontinence is also known as disability incontinence. It is associated with urinary incontinence, occur when the person's bladder or bowel is working normally, but he is unable to access the towel. This may be due to physical or cognitive condition. Nocturnal anuresis in older adults is usually multifactorial. Hypnotic use and nocturnal polyuria are frequently overlooked. It's often accompanied by other associated lower urinary tract symptoms and is complicated by comorbid conditions that affect of medication affecting sleep, congestive heart failure, functional disability, and depression has been associated with this condition. We have a comorbid condition that associated and cause and contribute to urinary incontinence. Comorbid medical illness, diabetes mellitus, degenerative joint disease, chronic pulmonary disease, congestive heart failure, lower extremity venous insufficiency, sleep apnea, severe constipation, and fecal infection. The neurologic and psychiatric condition, stroke, Parkinson's disease, normal pressure hydrocephalus, dementia, Alzheimer, and multi-infarct and others, and depression also. And medication also contribute to UI. Functional impairments like impaired mobility or impaired cognition. Environmental factors and inaccessible toilet or unsafe toilet or unsafe facilities, and no constructing color between the toilet and the seat, so the patient cannot see well, or caregivers unavailable to assist. What's the impact of incontinence? Incontinence can make isolation, depression, and psychological distress, inflammation of the skin, and increased caregiver load, can make sleep disruption, increased risk of UTI, urinary tract infection, and increased care costs. Urgency, frequency, nocturia, reduced mobility, and visual abnormality, this all can lead to fall and fracture. Fall and fracture and skin deterioration are all linked to increased risk of this. Now I leave you with my colleague, Dr. Rasha, to know what's the medication can cause urinary incontinence and how to evaluate and manage the patient. Thank you.
Thank you, Dr. Asjad. Thank you, everyone. So medication associated with UI. Alcohol, alpha-adrenergic agonists, alpha-adrenergic blockers, AC inhibitors, anticholinergic, antipsychotic, calcium channel blockers, cholinesterase inhibitors, estrogen, gabapentin, loop diuretics, narcotics, and sedative hypnotics. Next slide, you can see. Next, yeah. So now we go to the management of urinary incontinence. Start with doing like patient, when patient came, we try to do UI screening and evaluation, because most of the time patient doesn't mention anything about it. So we have a screen question about bladder and bowel problem. Do you have any problem with your bladder control? Do you have any problem make it to the bathroom on time? And do you ever leak urine? An examination, if he complain of any of those symptoms, so we can should be performed for all people complaining of new or worsening UI, and should consist of rectal examination. The red flag when you do the history and examination, if the symptoms start abrupt onset, pelvic pain, like constant, worsened, or improved with voiding, or hematuria, being cancer and other things. So investigation, urine culture and sensitivity to identify infection, UTI or other things. Bad test, measure both void and residual volume by bladder ultrasound or urethral catheter. Other investigation we can do urodynamic studies, is uroflowmetry, bladder outlet obstruction, cystometry to check the detrusor bladder contraction, activity, cystogram to visualize the bladder, and cystoscopy for tumor and stones. Okay, so we have like in management, we have to start with the behavioral modification. This is for all patients. Drink less than 5 glasses of water per day or fluid. Stop drinking after dinner. Elevated legs, time voiding, regular pelvic floor exercise, weight loss, smoking cessation. So for stress incontinence, which is the second most common cause in women, pelvic floor exercise, chill, can improve stress incontinence. This exercise strengthens the muscle that support your urinary system. Vaginal estrogen cream, gel, ring, or patch that strengthens vaginal muscle and tissues after menopause. Insertable vaginal pessary device that supports the bladder and urethra. Also, urethral injection to temporarily block up the urethral muscle and keep the sphincter closed. Surgery to place the slings made of your tissue, donor tissue or surgical mesh under the urethra to support it. So support it for that. So this is a Kegel exercise for men and women because they can do that. Okay. So this is a treatment like targeting the cause, or treating underlying cause. So most probably combination treatment may help to get better bladder control if you use the bladder behavioral and like a specific treat underlying cause, and sometimes we have to use other treatment. Diabetes mellitus, better control of diabetes can reduce osmotic diuresis and associated polyuria. If the UI associated with chronic pulmonary disease, cough suppression can reduce stress incontinence and cough-induced urgency, UI. A sleep apnea, diagnosis and treatment of sleep apnea, usually with continuous positive airway pressure device, may relieve UI. Reduce nocturnal polyuria associated nocturia. If there is severe constipation and fecal impaction, appropriate use of stool softener can help. Adequate fluid intake and exercise, and sometimes you have to do disimpaction if necessary, like enema or anything. Okay, neurological and psychiatric conditions such as stroke. UI after stroke often resolve after with the rehabilitation. Persist UI should be further evaluated. So if the patient like overall function after stroke improved, most probably UI improved too. Parkinson's disease, optimized management may improve mobility, improve UI, regular toileting, assistance essential for those with mobility and cognitive impairment in late stage. Normal pressure hydrocephalus patient presenting with all three symptoms should be considered for brain imaging. Okay, if the cause is dementia, like Alzheimer's dementia or multiple infarct or other type of dementia, regular toileting assistance essential for those with mobility and cognitive impairment in late stage. If the cause is depression, optimize pharmacological and non-pharmacological management of depression may improve UI. Medication treatment for UI and like MAO, stimulation of beta-3 receptors in the detrosor-mediated bladder relaxation. My bitrate 25-50 milligram QD, ADE, increased blood pressure. Prescribe carefully in patients with renal and hepatic impairment. Many drug, what's the drug? I can't see the other part. Yeah, many drug ARE like muscarinic receptors drugs. Other type of treatment also intravesical injection of botulinum toxin, make relaxation of the muscle, sacral nerve neuromodulation, surgery in case of stress incontinence, colbo suspension, like brush operation, slings, synthetic mesh, or auto or cadaveric fascia. So sometimes they use additional supporter here. So yeah, here is our reference. You can go if you want to. And thank you.
Thank you, Dr. Asjad and Dr. Rasha.
Thank you.
Anyone has any question or comment? Dr. Meher share link in the chat about the exercises to strengthen pelvic floor muscles. Thank you, Dr. Meher.
Thank you.
If no questions, we can proceed to our next agenda. which is public speaking and use of PowerPoint. Dr. Rayan, Dr. Ihab. Dr. Rayan, if you are ready, go ahead and share your screen.
Assalamu alaikum, everyone. Sorry, just give me one moment. Okay, can everyone see my screen?
Yes.
Yes, yes.
Okay. Assalamu alaikum. My name is Rayan. I'm going to be presenting public speaking. I hope that you guys are excited and you're ready. Inshallah, if you have any questions at the end of it, feel free to ask. Okay, guys, so I'm sure everyone's wondering what just happened there. This was an example of how not to public speak. Can anybody tell me what I did wrong or what I didn't do? Okay, no problem.
There was no eye contact.
Yes, exactly. So there was no eye contact. I was using a lot of buffer words. I was using I was using like, anything else?
You're looking that, yeah, no eye contact.
Exactly. Thank you, guys. So inshallah, today I'm going to be speaking on public speaking. I'm going to tell you what to do and how to become a better public speaker, inshallah, okay? Sorry, just bear with me. Perfect. Are you guys able to see this? Okay. Let me start from the beginning. We're not off to a great start. Please forgive me. Sir, Dr. Nader, can I send this to you? Can you share? For some reason, I'm not able to continue to the next slide on my part.
You can send it to me, Rayan. I will share it.
Okay, I think it's working now.
Working now, yeah.
Okay, perfect. So the objectives for today, we're going to talk about what public speaking is. We're going to look at the fears behind public speaking. That's the relationship of public speaking within the medical field. And then I'm going to give you guys some tips and tricks on public speaking. And inshallah, there's going to be an interactive session at the end of it. So I do encourage everyone who's able to participate, please do, okay? So what is public speaking? Public speaking is a formal face-to-face communication method. It's where a person uses the medium of speech to inform or influence a group of listeners, an audience. So public speaking entails three purposes. The first one is to inform, to persuade, and to entertain the audience. When it comes to inform, what you're doing is you're helping the audience members acquire information. You're allowing them to gain knowledge on your specific topic of discussion. The next one is to persuade. So what does it mean to persuade? It's getting the audience to make some sort of change in their behavior or thinking. You're allowing them to adapt a type of behavior not otherwise done. And the last one is to entertain. So you're focusing on this is focused on the theme and the occasion of the speech. So pretty much it's the engagement and the enjoyment of your audience. Next, we're going to look at verbal versus nonverbal forms of public speaking. So verbal, it's all about, again, verbal speech. So the projection of your voice. Next is the pronunciation and the articulation of the words that you're using, allowing yourself to be able to pronunciate the words properly and be able to articulate them in a way that your audience is going to be able to understand. Next is the rate of speech. So there's going to be times where you're going to want to speak faster versus speak slower, etc. Next is expressiveness. So depending on what you're speaking with, you want the audience to feel like you're passionate about your topic. So expressing that in the form of verbal communication. Next, it's the energy and tone of the presentation. So you don't want to have a monotone presentation. You want your voice to be able to, have different valleys and dips, etc. Okay. And next is nonverbal engagement. This includes engaging eye contact. So making sure that you have that eye contact with the audience. It's gestures. As you can see, I talk with my hands. Being able to explain with your hands, etc. Next is facial awareness. When to smile, when to become serious. So having that understanding of your face and how you're able to react to what you're presenting with the audience. Next is purposeful movement. What is purposeful movement? When you're on the stage, you don't want to just be, pacing back and forth across the stage. Instead, you want to be able to feel like you're engaging with the audience. So what does that mean? If you have a big room, you have people on the left, people on the right, people in the middle, you don't want to just be standing in one area. You want to be able to, go to the left, go to the right, allow that communication to be all over the stage and allow the audience to feel like, they're engaged no matter where they're sitting in the area. Next is the professional appearance. So depending on the type of engagement you're doing, it's important for you to also take into effect how you're dressed, how you're appearing for the audience, etc. So now we're going to look at the fear of public speaking. The medical term for fear of public speaking is glossophobia. So what is glossophobia? Glossophobia is the fear of public speaking and worry of judgment from others during a speech or presentation. So a person with glossophobia will be able to function well at home, at school, and in the workplace settings, as long as no one asks them to speak or present in front of others. So, you can have your friends, your colleagues, they have no issues as long as they're not standing in front of an audience and projecting some sort of presentation. You wouldn't know that they struggled with glossophobia. Next, people with glossophobia regularly pursue lifestyles that don't require public speaking. So you'll see them tend to go to like desk and office jobs, somewhere where it doesn't entail you having to get up and do different presentations, okay? Do you guys see anything on the screen? That's strange.
No.
No. Okay. I do apologize. Oh, okay. Seems like there was extra slides. No worries. Okay. So now we're going to look at the clinical presentation of glossophobia. How does it present? So the person will have high stress, anxiety. They'll have panic. So they'll have panic episodes when they're asked to speak in front of a group. Next is speaking situations almost always provoke an anxious response within the person. Social situations or situations where public speaking is expected are usually avoided, or if they're not avoided, they're experienced with high levels of anxiety. The level of anxiety felt by a person does not match the threat created by the situation. So what that means is the anxiety or that sense of anxiousness that the person is feeling, you wouldn't necessarily match it with public speaking in a sense. And in this case is what we're talking about. Next is the anxious symptoms. They persist for 6 months or more. The high stress and anxiety produce distress that is clinically apparent, and it interferes with their other areas of life. So in this case, if they're always having to present, or if they're, have the ability to present, that can really affect them in all aspects of their life. So we previously spoke about how they choose certain careers where they're not having to do that. So if there comes an opportunity where they're asked to present, they may easily just, look for a different job or change careers, okay? The fear, anxiety, and avoidance are not caused by effects of substance misuse or a medical condition. And the symptoms are not yet better explained by another mental health disorder. So what are causes of glossophobia? So public speaking anxiety can be caused by environmental experiences and biological traits. Common causes of them include inherited traits and family history. So a person is more likely to have glossophobia when a close family member has an anxiety disorder. Next, we're going to look at the brain physiology behind it. A part of the brain called amygdala, it manages a person's fear response. So when this structure is overactive, stress, anxiety, and worry will all be heightened within the person, okay? Next is life experiences. If a person has a string of negative public speaking experiences, they could begin developing the condition. So in this case, they've had many failed public speaking opportunities to the point where now it's become a fear. Next is parental influence. So having a parent who displays high anxiety when speaking or who are overprotective increases the risk. Okay, so now we're going to look at the treatments of public speaking. We have two. First is cognitive behavioral therapy. So cognitive behavioral therapy is founded on the principle that the way a person thinks, feels, and behaves are all interconnected. So the anxious feelings can be corrected by changes to their thoughts and behaviors. One example of cognitive behavioral therapy that is highly used within glossophobia and fear of public speaking is exposure therapy. So what happens is exposure therapy creates desired benefits by allowing the person or client to confront their fears. So presenting that fear or allowing them to continually practice public speaking so that eventually that fear will subside. Next, we have medications. So in the acute stage, we would prescribe benzodiazepines and beta blockers. And then for chronic, you have SSRIs, SNRIs, and MAO inhibitors. Okay, so we're physicians. So let's look at public speaking and the role of medicine and how it affects us as physicians working in the field of medicine. So public speaking itself, it's a tool of engagement that can make an emotional or an intellectual connection between a physician and their patient. As physicians, it's our responsibility to have the patients entrust us in what we're saying. We're supposed to talk with confidence, with knowledge. Again, remember the three purposes. You're informing your patient of the medical illness that they have, for example, okay? So you're giving them that knowledge that they need. Next, you're persuading them in a sense of, this is the medication, or this is the treatment that you need to be, that I would recommend to you, and it's important to also engage with the type of audience that you have. As a physician, you need to be able to really identify your audience. And so having that identification of the audience, it'll allow you to be able to change the way you react. The way a pediatrician will talk to their patient is very different than, say, right now we're in geriatrics, right? So you have to also keep in mind the audience in which you guys are trying to project that stance to. So public speaking in medicine, we use it in grand rounds lectures, like I said, communicating with patients, as well as other health professionals. We use public speaking within the medical conferences whenever we have our presentations. Alhamdulillah, last week, we had one of our colleagues, Ala, she had the chance to present her topic. So again, she had all those, she knows how to public speak, she was able to engage with her audience and present her topic. Next, we have television interview. We saw television interview a lot within the pandemic. So every time, you would open your news channels, you had a lot of doctors presenting. So you have to keep in mind, when we say public speaking, it doesn't necessarily mean having a physical audience present. It also means, doing it remotely, doing it virtually, as I'm doing right now. Next, telemedicine. Again, telemedicine has become something that's so used, especially with the pandemic. people weren't seeking to go in person and see their doctor. So you need to be able to practice those skills to be able to do it virtually, not just physically. So some tips and tricks that I want you guys to take with you is practice, practice, practice. The most important thing to do is record yourself. I wouldn't recommend public speaking with a mirror. So if you have a mirror and you're trying to practice, it's not always the best. They say record yourself so that way you have that visual image of you. Sit down, practice the verbal and non-verbal communication with a video camera, and then play it back to yourself. Next is keep your purpose in mind. We had spoken about this at the beginning, is make sure that what you are talking about, you're passionate about it, And next is your audience wants you to succeed. No matter what, don't fear the audience. They're there for you. They want you to succeed. They want you to do well. They're there to learn and benefit from what you have to say. So always keep that in mind, that you're probably your biggest cheerleaders at the moment. And so try to approach it with a sense of, these people are here to see me and I'm here to deliver my information to them. So inshallah, everything was good. I hope that, you guys benefited from this session. I have an interactive session. So with this, if you guys are able to, I'd love for you guys to open your cameras and your mics and engage in the game. So what's going to happen is I'm going to give you a topic. I'm going to give you 10 seconds to think about the topic, and then I'll allow you 20 seconds to speak about this topic, okay? And keep in mind the verbal and non-verbal communication that I had presented in the beginning. So maintaining that eye contact, using gestures, the projection of your voice, etc. So let me just open my gallery. Oh, perfect. I see one hand up, Iman Lay. Do you mind opening your camera for us? Awesome. Okay, so I'd like you to speak about why did you choose medicine as a career? So I'm going to give you 10 seconds just to kind of think about it and, get your thoughts in order. I'll put a timer just so we have that. Okay, so I'm going to put the timer right now, and then whenever you're ready, please feel free, okay? Go ahead.
So my name is Iman Dai. The reason why I decided to go to medicine, that from the beginning, I was very interested in the human body and the human mind. And I wanted to study. It was very interesting to see that how little do we know about something that we basically, our existence depend on. So I wanted to go into that and to try to understand mainly the human body, the human mind, and then the human body. And I also love the challenge where like the making the decisions and looking at every case as a puzzle and figuring out what's wrong with people. That was my
okay, sorry, I was so intrigued in what you're saying, I lost track of time.
Sorry.
My apologies. Thank you so much. That was excellent. As you can see, guys, she was using her gestures. She was keeping eye contact, and I should have kept better time, but I was so lost in what she was saying that I forgot. Do we have any other volunteers? I'm not sure if anyone has their hand up.
Yeah, there is Sarah Trafi, I think.
Sarah Trafi, okay, let me just. Okay, see? Okay, Sarah, open your video. Maybe I'll be able to see it that way. Do you have your video open? Sarah, are you there? Okay, if she's not available, do we have any other person who has their hands up? Don't be shy, guys. I might just choose a random person. And we don't want to take up too much time. So any volunteers?
I can try.
Okay, awesome. Thank you, Amy. Perfect. So unmute yourself.
Mm-hmm.
So I want you to tell me about something that you're passionate about. Okay, it doesn't have to be medicine, just something that drives you. So I'm going to give you 10 seconds to get your thoughts in order.
Sorry about the noise. It's my kids.
No, no worries. I don't mind it at all. Okay. Please start.
Okay. So the first thing that came in my mind is I love dancing. I always try to dance whenever some music, some Bollywood music, something comes up, and I try to perform as well in programs. The reason I love dancing is this is something I enjoy a lot, and I feel it's a very nice way I can transmit my energy, my joy, and also I can relieve my stress. Like if I'm stressed, I listen to music and dance it out. So I love it, that's why, and I'm passionate about it. If I get chance, I would love to learn maybe professionally someday.
Awesome.
But
Thank
if
you
I get
so
a chance.
much. You know, what's amazing is you can feel your passion, your smile when you're talking about it. So thank you so much for sharing that with us today. I really appreciate it.
Thank you.
Of course. And that's all for me. So thank you guys so much for having me. Thank you, Dr. Nader, for the opportunity to present as well.
Thank you so much. That's really great. Thanks for the presentation. Yeah, I like the idea of interactive session. Yeah, please. Go ahead. Yes.
Thank you, Dr. Rayan. Now, Dr. Ihab.
Yes, Assalamu alaikum, everyone. Hello, everyone. And I'm going to talk about use of PowerPoint. If Dr. Rayan, stop sharing your screen so I can do that.
I'm so sorry, guys. I'm going to stop sharing it right now. Okay, go ahead, Dr. Ihab. Thank you.
Thank you. Hello, everyone. My name is Ihab Ahmed. I'm going to talk about the use of PowerPoint presentation. Of course, you know, now we are in the era of online or virtual learning. So PowerPoint now become a very essential tool to be used in studying and learning and communicating with other people and conveying your ideas or your lecture to other people. So I'm just going to talk a little bit about PowerPoint and how to make a PowerPoint. Of course, you start with a blank presentation, and then you put your text, and then you add your content in each slide, and with animation and everything. And I think everyone knows about it. So just like this is just like a brief step of how to do it. Now everyone is using it, and they're using it very good. So of course, in the PowerPoint you have the ribbon. Sorry. In which there is a file, home, insert, design. All of those functions has its own way of use, and of course you can just practice more and more, and you can use them better and better. And in the home page, you can I guess okay. You can add text or you can formulate your default setting for the whole PowerPoint. And there's also the views in which you can edit your PowerPoint. And finally, you have the design in which you can choose an attractive style that is appealing for your audience. For presentation, always avoid dense text-dense slides. Like if there are a lot of things written in your slide, it's a little bit distracting. You can avoid that by using, there is a tab in the bottom of your slide where you can add notes. So those notes, you can read it, but other people cannot see it. So you can just, instead of just reading what is on the slide, you can put some points, and then you can talk about them from your mind or from the text, which is hidden. And if you go back, any one of you, if you go back to our presentation, you find in each slide there is add text in the bottom of the slide. You can use that to, if you don't want to just talk out of your mind, just you can use it just to read from it instead of read from the slide itself. And a number of slides. Always plan to do like 1 slide per minute. That is like the golden rule, kind of. And or reduce redundancy, and because you will distract your audience. Incorporate active learning throughout your presentation, and this is what Rayan has did just a few minutes ago. It was very interactive and very engaging. To emphasize on the content of your presentation, you can use like bold text, or you can use different colors, and you can. It's always better to reduce the background colors, and so to reduce distraction, or don't use too many colors or shifting of colors throughout your slides to keep your audience focused. Also, there's importance that to avoid using underlines to emphasize your content, because underline, if you put underlines, means hypertext. That means it's a link that can take you either to another slide or to a web page. So yeah, this is all about just avoid a lot of pictures or photos or graphs in your slide. You can use it to you can use you can ornate your slide, but in a way that keeps the focus of the people, and it support your idea about what you are presenting. The font size, it's better to be read from distance, or for everyone. 36 to 40 point font style is the best. It's just like a suggestion. And also for clip and arts and graphics, don't use irrelevant graphics. They are will hinder learning, and will take people away from the point that you are trying to talk about. The aim is to add realism to your presentation. So just use what relevant pictures or drawing or any media that you want to use. So also you can add some animation, motion, sound, or music, as long as it supports your idea, and as long as it's engaging for your audience. Finally, check on spelling. It's very important. Give your slide or your power presentation to your colleagues, and let them look at it. Let them criticize you. They may find things that they may see things that you don't see, some mistakes, and practice your session before your session start, and also prepare for plan B. And this is mainly for like when you are in a class and you have your presentation in like external drive, and when you come into class, that your drive is not working or your external memory is not working. So like what I used before during my college days, I used to send my PowerPoint to my email. So if anything happened in my external drive or something, I can access my email and just pretend them. That would be easier for everyone. There is a handout. It is a print of your PowerPoint presentation. You can print it out and you can give it before the class, during after the class. If you give it before the class, people can read it and they prepare their question before you start your presentation. During the class, you can give it your printed PowerPoint during the class, and this is good because they can take notes while you are talking, and or you can give it after the class. So during the class, people will be more concentrated, or you have the option not to give any paper. There is during presentation, what we all do is that we are reading from the slide. It's always better to just talk about the slide, not read it. And if you don't want to just read, talk about what you memorize, you can use the option of adding notes in the bottom of the slide. So yeah, you can read it, but people will not see it in the slide. And also use black screen, as we said, just to reduce distraction. And you have backup plan for any technical failure, and give your time while presenting your topic, and not to rush yourself. This is about PowerPoint. I'm going to talk a little bit about Google Slides. Google Slides it's a free web-based online-only tool by Google. The difference, it has some advantage. It is easy access because you just need Gmail to have Google Slides. It engage teamwork because the platform is online, so everyone can come and edit the slide at any time. So there's sort of collaboration between people. And it's also compatible with other Google applications like Google Photos or YouTube. And it automatically saves your work, so not lose it. If it's not like PowerPoint, you have to take it to your class through your external drive or external memory, something like that. So it automatically saves it. And of course, it's free. Just it needs a Google account, that's it. The difference between PowerPoint and Google Slides that the access of PowerPoint is through Microsoft Office. You have to buy it, or there is also some form online, but mainly it's better to be bought. But while Google Slides is online, both of them they support different formats, but PowerPoint is better in supporting more formats. And both of them, they can allow collaboration in the teamwork, but PowerPoint allow collaboration through OneDrive, while Google Slides is through Google account. Both of them, they support animation and audio, but video through Google Slides is only through YouTube or Google Drive. Offline is there for PowerPoint, but for Google Slide, it must be installed to have offline form. And both of them are available for PC or Mac, the Windows or the Macintosh. The impact of PowerPoint on learning. Many students, they prefer PowerPoint. They think it's more engaging. In 2012, there is a study about like PowerPoint presentations versus regular classes, and they don't find any one of them is better in entertaining or boring. The assertive evidence approach, which is like, it means like when you add figures or diagram into your speech. In studies, they found that it promotes understanding. In many different studies, I guess mentioned 2 studies here. PowerPoint presentation versus the Blackboard, which is like the traditional way of teaching. In one study, they found that 66.1% of students found PowerPoint presentation is better and more effective tool than the traditional Blackboard. And of course, in PowerPoint, you can put larger number of facts, not just like a chart on a Blackboard and writing on a board. This is what I have about this topic, and if anyone has any comment or question, it's open for everyone. Thank you.
Thank you, Dr. Ihab.
Thank you, both. This is great and excellent concise presentation for good skill that we need to use, a tool that we always need to use as for presentation. There are a couple of other tools. What I'm going to share with you in the chat box is a link to a YouTube, and I'm going to just share the YouTube as well with you guys. So I did share the link, and basically this is from UC Davis School of Medicine. These are, I think, 3 or 2 presenters about their PhD. They summarize their presentation or their studies or their work. And if you want, you can look at what they did as far as how they use the background, as mentioned by Dr. Rayan, how they used imaging videos and so forth in their presentation, using the colors, for instance, with different colors to identify certain facts about their work. You don't have to be too much like a lot of colors. You stick to one concept, like for the first presenter, she used yellow as our theme for presentation and so forth. And then the second presenter used different imaging to figure out the points that she wants to present, same with numbers and so forth. So if you have time, you can look at this video, this presentation, and maybe you can identify areas where the presenter just showed you how to highlight stuff, how to present. Sometimes you want to put the point, but you want to elaborate more. So you don't put a lot of text, you just put a summary of 2 or 3 points, and then you can elaborate when you are talking about the slides. And then we can talk about this skill with using the presentation as coach in the next presentation. Thank you so much. Excellent presentation. Thank you.
Okay, Dr. Osama.
Yeah, I'm here. 1 second, let me just share my screen. Hello, everyone. My name is Osama Abdul Samad, and today I'm going to talk about rehearse coach. So first, what is presenter coach, and how does it help you with your presentation? So we can do this first. We can start the rehearse, so we can demonstrate it live. Start rehearsing. So basically we consider the presenter coach as a, oh, I'm sorry, we can finish. So basically we consider the presenter coach as a friend who listened to you and give you a score at the end. It kind of give you a report of your performance, detailing couple stuff, your weakness and your weak stuff. So you see now that I said a lot of so it actually like told me to not say it. So for the presenter coach, we have 4 things that we usually focus on. So the first thing that we focus is how fast you speak. So ideally, we try to not speak too fast or too slow. So just like in the middle, that would be perfect. That's the first thing. The second thing is we try to not use filler words. Filler words like or ah. It make your presentation less professional and less less sharp. So we try to avoid this. I said again, so I should avoid this. And the third thing that we should avoid is actually sensitive words that we're going to talk about later. And the fourth thing that we should avoid is we should avoid to read the presentation just like in the slide. So you should try to read the presentation in your own word or on your own way. So what will we need? First, we'll need a Microsoft account or a Microsoft 365 work or school account. That's number 1. Number 2, we'll need a working internet connection. That's number 2. And number 3, we need a microphone. So I think I said everything like in the slide. So it's gonna tell me to try to do it in my own way. So how do we launch the presenter and how do we use it? First of all, we go to the app. We can open it from there, or we can use the desktop because a lot of people use the free version. So we go there and we can see that there's a slideshow. So you press slideshow. That's step number 1. Step number 2 is you should look for this rehearse with coach. So you try to open this rehearse with coach. That's step number 2. And then step number 3 is after this, after you press the rehearse with coach, the presentation open in full screen mode. After this, you press start rehearsing, and then you start presenting as normal. So you start explaining your presentation as normal. And then there is a like a window here that tells you that if you do something like here, it tells you to, if you say something wrong or if you're doing something wrong, it tells you that you're doing this wrong. So it's here. And then after you finish your presentation, then you press escape. So I said again, so I should focus on this. After you do escape, then you exit the full screen mode. And then after you finish everything and you exit the full screen mode, it gives you a report detailing your weak points or your strength. So how do you read the rehearsal report? It's very important to read it and analyze it because it contains a lot of points that your weak points and your strong points. So you have to read and analyze those points carefully so you can be a better presenter in the future. There's another note that the report will vanish quickly, so you should take a screenshot of it. So here's an example of the report. So here we have the summary. The summary here, it gives you a good job. Like sometimes it gives you a good job, sometimes it gives you a fantastic. It depends on your performance. Here you have the total time spent on presenting. And then here you have the total slides rehearsed. And the fillers, so the fillers, those are the words that you say, and it makes your presentation less professional, and it makes you sound less confident and polished. So you try to avoid those words. It's words like like you try to avoid it, and I didn't try to avoid it. I said it a lot, so I apologize for that. We usually try to avoid repetitive language too. And then the pace is basically your words per minute. So this is slow and this is fast. So ideally you should aim for something here in the middle, like here. That would be perfect. And then here you have your average pace over time. This is the beginning, and this is your average pace over time. Here you have the pitch. So the pitch, we ideally try to make the pitch more to the high side, because if you speak on a low pitch, the audience will lose interest and they would think your presentation was boring. So you'll try to make it more high pitch. And also, you always try to increase your tone if you have something important to say. So like always aim for high when you're trying to say important stuff. And then the originality, it's you trying to make your presentation, like you trying to present your presentation in your own way. So just, it's not like you're reading it aloud. If we go to the next slide, here we have the summary we talked about. We have the fillers we talked about. This is the sensitive phrases that I mentioned earlier. So sensitive phrases, it's phrases that it's sensitive, so you should not, or like you should avoid it. It includes disability, it includes age, gender, sexual orientation, it includes mental health, geopolitical topics, and profanity. We did the pace and originality too, we mentioned it. So when you finish everything and you read your report and you analyze it and you figure out your weak points, then like you can try and rehearse again to be a better presenter in the future. Thank you for your attention. And now I think he's gonna give my report and it's gonna be bad. Okay, let's see. So that's my report, if you can see here. So that's the summary, that's the total time spent. So that's total of 7 minutes and 49 seconds. And I have 10 slides rehearsed. And then the fillers, I said a lot of fillers that I should avoid, like basically, like, I mean, so those are the words that I said, and it made my presentation less professional. So and basically and like and I mean, those are the things that I should avoid next time. And repetitive language, those are the words that I kept repeating, so I should avoid this too. So it's very and ideally. So those words are not professional and I should avoid it next time. And the pace was actually in the middle, so it was not fast, it's not slow, so it was kind of good. And the average pace per time, it was fine. The pronunciation, they said presenter, probably need some work there, presenter. And here the pitch, it was fine. And then the originality, it shows you the slides that you just or like you didn't present it in your own way. So those slides, I didn't present it in my own way. I read it, but it wasn't on my own way. And thank you guys, for listening. And if anyone have a question, feel free to ask me.
Yes, Dr. Sama, and these features are only available to make slides in PowerPoint and not in a Google Slides.
Excuse me, I didn't hear you. What was your question?
Yes, I want to ask these features are only available to make slides in PowerPoint, and these not available in Google and slides.
Yes, it's only available in PowerPoint.
Oh, thank you.
Thank you so much, Dr. Osama. Any question or comment?
Thank you so much, all the presenters. This is great again and to the point, and I think it's a useful tool. It's just for practice and for improvement. So for all fellows, maybe you can use it in the future. As the last question was about Google Slides. So what I do usually, if I'm working on Google Slides, I finish my slides and then download it as a 4.5 and then go to Microsoft, upload the file there, and then I practice on this rehearsed coach again. And if there's an area of improvement, then you can see what you can do to improve there. Thank you so much, everyone. And before we go to the next section of the meeting, I'd like to introduce one of our fellows, Dr. Sumi. She is with us from the beginning of the program, and she matched to a residency program. And I want to share, if she has a couple of minutes, to share her input and if there is an advice to the new fellows. And when you're ready.
Yeah, thank you, Dr. Nadir, for the nice introduction. Thank you, everyone. Nice meeting you all. Some of them I already know. Some of you already did the fellowship with me last 2 years, and some of them already left. And it was a nice, I think it was a very expensive, I would say, very valuable experiences I have gathered for last 2 years. And Dr. Nadir was very, very helpful throughout the difficult journey. I would say this fellowship actually was very, very valuable in order to get my residency, and also prepares me very well for the interview, as well as the I was very confident because this is a platform that you can share things with your peers. You also have the opportunity to learn things from your peers, and also you can I know that all of you came from different background and different perspective, and everybody has a different kinds of challenges. So, I was in your shoe not too long ago, but, all I can say is if you are very dedicated, very hardworking, you will get into it. And some of you already know me that, I was involved in multiple research projects here, as well as I still have been working as a research specialist in the University of Michigan. And so I tried my best to gain, research experiences as well as clinical experiences. And my idea was that I analyze my CV every year and wanted to see that, how can I improve myself? And, that's all I can tell you, that especially for the people who are little bit old graduate, it's a very difficult journey, but don't quit. Just working hard, you should work hard, and also I would say instead of working hard, you have to work very smartly and try to analyze your CV, what are the things that you do not have your CV. Try to improve, make connections, and based on your CV, try to do something unique, and which like, you know, you can present during your interview, or like make connection with the program, and that program, like, it seems like it's better. The program knows you rather than like you know the program. So I think you understand like what I'm trying to say. And this research fellowship would be very, very helpful. One example I can tell you that like I mean, when I started this fellowship just after the pandemic, so as like very few opportunity for the conducting research, because that was the beginning of the pandemic. But my project was like the the relationship between the multiple comorbidities and the mortality of the COVID. And this project, basically, I was one of the co-investigator with Dr. Nadir. And this project went very well. And I had the opportunity to present with American Geriatric Association as well as AMDA. And one of my abstract was indexed by WHO. And I think which gave me a very good platform. And I was able to explain to the interview. And some of the program director actually specifically asked me about the project and what's my, future goal about this project. So, like whatever you are doing here, like it's a very good platform. And also like me and my other colleagues or whoever we are, like we are in different programs such as like internal medicine, mostly in internal medicine and family medicine. Some of them also went to psychiatry and neurology, a very few, but we are here to help you all. We are in now like the way we help each other is like a family. We used to have the WhatsApp group, and like during interview preparation, personal statement and whatnot. I mean, we shared everything, and then we almost like, I think from the first batch, almost all of us matched this year mostly. So the journey is difficult, but just play this game very cleverly. If any one of you have any specific questions, I'm here. You can ask me, or like probably you can email me like any research questions or like any other questions. I'm happy to help you. Thank you so much.
Thank you so much, Dr. Sumi, and always good to have you, and thanks, and wish you all the best. Thanks for sharing and availability as well. So if anyone of you fellows you have questions, she will be available to help. And we have another fellow. Also, we have good news about him, Dr. Wail. He is also the same batch and started with us. And he got accepted into a fellowship program. He spent the first year with us, and then the second year he joined Mayo Clinic at in Jacksonville, I think in Florida. So when you have a minute, please come. That's all right.
Assalamu alaikum. Good afternoon. Can you hear me?
Yes, go ahead.
Yeah, we can hear you. Good afternoon.
Thank you so much for having me today, Dr. Nadir, and thank you so much for the opportunities at Telegeriatric Research Fellowship. It's a tremendous help actually for everyone who's looking to do a residency in the United States. I was one of the first batch. I was Dr. Sumi classmate. We started in 2020, and we did a lot of abstract together. And then I joined Mayo Clinic. It helped me actually. The Telegeriatric Research also helped me to get into Mayo Clinic in Jacksonville for the research as well. And I just got accepted yesterday or today morning actually into a geriatric fellowship. And because of the Telegeriatric Research Fellowship, it was very, very, very helpful in getting a getting a research and getting into fellowship, a geriatric fellowship. Because of the geriatric fellowships, as you know, goes unfilled due to many reasons, and they are looking for someone with an something scholarly related to geriatric medicine. And all of you, hopefully, unfortunately, if you don't match, if you looking for an alternative pathway, this fellowship will help you get into alternative pathway, especially if you have a step 3 as well. Will help you get into fellowship without getting into residency, without having a US residency first. But thank you so much, Dr. Nadir. The Telegeriatric Research, it's very, very helpful experience. You're not just learning research, you're learning a lot of skills, interview skills. You're learning a lot about the United States health system. You're learning a lot of tips and tricks about the application, ERAS application. I don't know, there's a lot of people in here. I don't know if you are all applying this year or if you are ready to apply, but it will help you if you are applying this year, if you are willing to apply in the future, it will help you a lot into getting into residency. I'm definite about that. Thank you so much.
Thank you again, Dr. Wail. It's great. Thanks for your input and feedback. And we wish you all the best. Good luck. Congratulations. And thank you. Thank you.
Thank you so much. If anyone needs any help with getting into research at Mayo Clinic or in getting into to know a lot about getting into a fellowship, you can reach out to me anytime. I would be happy to help. Thank you.
Thank you. And Dr. Sumi shared her email in the text in the chat box. If Wail, please share your email so that if there is any question or inquiry, they can email you. Thank you so much. Thank you.
Of course. Thank you.
Appreciate it. Have a wonderful day. Afa, you can.
Nice to see you, Dr. Wail, again.
Nice to see you as well. Thank you.
To see you both of
Good
you,
luck.
and good luck.
Thank you.
Thank you so much.
Thank you, Dr. Sumi and Dr. Wail, for joining us today. And now we proceed for our next topic, evidence-based practice. I think there is no question, right? For no questions. Okay. Our next topic is evidence-based practice. Dr. Maya.
Yes, Dr. Fra. Thank you.
Share your screen and
yes,
presentation. Yes. Thank you.
Yeah. One minute, I am sharing my screen. Hello, you got my screen shared?
Yes.
Thank you. Hello, Dr. Nadir. Hello, everyone. Today I'm going to present last topic of today's presentation. My presentation topic is evidence-based practice. So first, we have to know what is evidence-based practice. Basically, evidence-based practice is applying for translating research finding in our daily patient care practices and clinical decision making. It means integrating individual clinical expertise with the best available external clinical evidence from systemic research. So now we have to discuss how we apply this evidence-based practice in our daily practice. when we work in a hospital, when we work in a clinic. So there are a number of evidence-based practice processes that have been developed to help healthcare providers implement this evidence-based practice in workplace. Then we have few models that way we can apply this evidence-based practice in our workplace. So there's a one approach to evidence-based practice is based on 5-step model. So step 1 is ask. Means like we have defining a clinical relevant question, like doctor searches for information to find correct diagnosis. Then step 2, attain. Searching for best evidence, doctor searches for evidence to support the finding from step 1. Like we already discussed, step 1 is ask. And then step number 3, we have appraise. Like assessing the quality of evidence. Doctor must ensure that quality and reliability is high. That means what we are giving to patient, any treatment, any evidence about the treatment, that have high quality and high reliability. Then we have step number 4, how we apply this, like acting on evidence to form a clinical decision based on step 1 and 3, like ask that we already discussed, ask, attain, and appraise. Patient and doctor jointly make an informed treatment decision. So that means we have to first discuss the treatment with patient, then patient must be agreed with treatment which we are going to discuss with patient. Then step number 5, assesses, like evaluating the process. Doctor and patient assesses if the intended outcome is achieved and adjust treatment decisions accordingly if needed. So these are the 5 like different steps how we like apply this evidence-based practice. Then I'm going to discuss about PICO model, little bit about this. So learning how to properly formulating a clinical question so that an appropriate literature review can be conducted in one of the most difficult aspect of employing evidence-based practice in a clinical context. So one model used is called the PICO model. This we already discussed in our previous, I think second last presentation. So PICO actually is a P is stand for who is the patient population, and I stand for what is the potential intervention or area of interest, and C is there is a comparison intervention or control group, and O is stand for what is the desired outcome. So this is about the PICO model. Now we have to discuss about the literature review search techniques. So an important part of evidence-based practice is become familiar with resources that are available to gather the information. And these are the like different websites we can get more information about the evidence-based practice, like PubMedicine, SCP Journal Club, and Cochrane Library, Rational Clinical Exam, and TRIP, like turning research into practice. Then we are going to discuss about the level of evidence. We have different level of evidence. We start from the bottom to top, like we have editorial and expert opinion, case series or case reports, case control studies, cohort studies, randomized clinical trials, and meta-analysis. So we have to discuss a little bit about all these. I know we all are familiar with this. We face many times these topics in our presentations. So first, case control studies. A case control studies is an observational retrospective study looking at historical data that compares the patient who have a disease with the patient who do not have the disease. For example, a group of smoker, the exposed group, and a group of non-smoker, the unexposed group, are recruited and followed over time. This is a case control study. And next we have cohort study. And the modern definition of cohort in a clinical study is a group of people with defined characteristics who are followed in order to determine health-related outcomes. Then randomized clinical trial. A randomized clinical trial is one that uses randomization when allocating people to different arms of a study. This means that treatment groups are chosen by chance using a formal system, and each participant have an equal chance of being selected to each arm. This we call randomized clinical trial. Then we have meta-analysis. Meta-analysis is a systematic, statistics-based review of data that contrast and combine results from different but related studies in an attempt to identify patterns, disagreements, and other relationships across multiple studies. A meta-analysis can support a stronger conclusion than any individual study, but may be flawed because of publication bias. Then after we have some models of evidence-based practice. So these models are very important to implement our evidence-based medicine into our daily practice. I'm gonna be just mention these names, and I will provide a link at the end of my presentation. So if anybody want to search more about this, they can do it. So first we have our model of evidence-based practice to promote quality care. And second model, we have the advancing research and clinical practice through close collaboration model. And third, we have Johns Hopkins nursing evidence-based practice model. So these different models are very helpful to apply this evidence-based practice in daily practice. Then I'm going to talk about what is the difference between evidence-based practice and research. The difference between evidence-based practice and outcome research is one of focus. While the main focus of evidence-based practice is providing the best care to patients according to clinical evidence and experience, the main focus of outcome research is predefined endpoints. Then these are the references you can, if you can want to explore more about this evidence-based practice topic, these are the links. And thank you, everyone.
Thank you, Dr. Maya. Thank you.
Thank you, Doctor.
Is there any question or comment? So we are done with our agenda today. Last agenda is projects update.
So thank you all the presenters. That's a really great presentation, and thanks for your effort, your great work. So for the projects, we have a couple of projects going on, and some teams are forming. So anyone wants to share any updates? And also we are open for ideas. If anyone has any research question or an idea of a topic of the research, we can discuss here. Please Ihab, go ahead. Dr. Ihab. Go ahead.
Hello.
Hello.
How are you, Dr. Nadir and all the doctors? So me and the other dentists, we are four now, me and Dr. Mayada, Dr. Sahar, and Dr. Ruya. We had discussed a topic about how like hyposalivation or xerostomia may affect the weight loss in elderly. And we would like to start a project on this topic, and we need to know your opinion about that. Like, what do you think about this topic? Thank you.
I think it's a great idea. I think so. If you want to focus on older population, that might be relevant, and we can look at the literature, see what's there and what's missing, so we can focus on the missing part or the gap, what we say, and we can work on that. Excellent. So my suggestion is to form a team. You can be only dentist if there is anyone else interested in joining your team, and then we can work on what the next step. Usually we will look at the literature, and then from there we can see how we can approach the methods and data collection and so forth. Good.
Okay, thank you so much.
Thank you. I think someone else wants to first please start hand. Go ahead.
Good evening. Good evening, everyone. Hope everyone is having a good day, and would like to say thank you to the presenters and congrats Dr. Sumi and Dr. Wail. I have updates about the project that I'm working with in the group. It's about the comparison between the geriatrics and pediatrics in their COVID-19 and its complications in the pancreas. So right now, I have good news that we're almost done. We're like 90% in the data collection. And now we're working on writing the abstract in order to check the introductions and the methodology. However, we're looking into adding the sums of all the population that we looked into these researches, and hopefully we can form a flow chart out of that. And that's very interesting, inshallah. Thank you.
Good. And thank you so much, Dr. Mustaz and your team for the update. And this is a great step. So good luck with the next steps. Anyone else wants to share the progress or ideas?
Hello, Dr. Nadir. This is Amy.
Sure, go ahead. Amy.
Hi. Hello, doctor. I'm working in that project with MAFAS, but I had a question. Like, I live in Michigan, so I actually texted you as well. Like, is there any opportunity that I can, shadow in the hospital or something with you as a part of this geriatric fellowship?
So this is a great question. So in the past, usually we see, like we teach medical students here, I go to nursing homes. In the past, I used to work at the hospitals, their hospital. But currently, my practice is only in nursing homes. So I'd be happy to have you if you want to bound with me. The group of physicians in Flint area or Detroit area, also they can offer some shadowing or extension if you want to do some. So in the past, like batch what joint residency of this fellowship, some of them attended some like clinic in Flint. So that might be an option as well. Thank you for the question.
Okay.
All right, Muhammad.
Yeah. Hello, Dr. Nader. How are you? Good evening. Yeah. My question is, I asked several times to join a project and tried to come up with some ideas for a project myself. Where I work is I work in ICU, but we have many geriatric patients coming, like strokes, people on ventilators, and sometimes LTC cases. But I have several ideas in mind to pose as a project, but still my question is for to really work on the project, what would be the obstacles regarding the sample size, the facility, the centers, how to just if I want like colleagues from here to be involved with me, if I got the at least the authorization to work with the cases we have. I think the turnover is rapid, but it's not that not all the patients are considered geriatric, and I don't know, maybe sample size would be an issue. So I want your comment on this.
So maybe I can ask you a few questions just to clarify. So what's your population? Are you going to clinics? Are you going to hospitals? What's your setting? Where are you located now?
Located in UAE and Sharjah city, and I work in I think a 14-bed ICU.
So you are in the hospital ICU, and
Yes.
you are in training. You have attending, or you are attending there. You are the.
No, it's not the training job.
It's a training.
No, it's not the training job. It's like resident medical officer.
So you are the medical officer. Okay, that makes life easy. So basically, what you need to do is you have electronic medical record as take it or paper format.
What?
The medical records when you see patients, do you
Yeah,
document?
EMR. We utilize EMR.
EMR. Okay. So from the EMR, if you have an IT team, the technical staff in your hospital, what you
Yes,
can,
we have.
Okay, what you can say, what you can do is you can just get in contact with them, tell them, hey, I'm doing a fellowship and I'm interested in doing a research and looking at certain charts or records, and
Okay.
I need your help. So what I'm gonna do, I'm gonna just list some of the variables that I want to look at, and then I will give it to you. You can run a query. Most of the time they will do that for you. They will get all the information in an Excel sheet for you.
Okay.
I take it this is the best way to approach. The other way, or the old way of doing it, is you open each patient chart and then look at
take information.
This will take usually a long time, but if you can do it electronically, the IT can help you. They run a query. It will take just 1-2 minutes from their time.
Okay.
They might need an IRB approval. Here in the US, you have to go through an IRB approval. So what you can do is you can write a letter stating that this is my question or the idea of the research. Usually I will say, for example, COVID and babies and other something like that. So you have a population, you have a question, and then in the next section, you will say, I'm going to review the chart, looking for these variables. Let's say I want to get the age of the patient, gender of the patient, comorbid condition, something, whatever, lab, whatever. These are the variables that you want to study. And then you want to say, I want to look from the period of time, like I want from, let's say, 2019 to 2022, and then you will put what the risk for the patient. So when you look at this chart, you will say, I will do identified data collection, which means you are not going to collect their name, their date of birth, or something like that.
We call it unidentified data collection.
because it goes through the IRP, and there is no connection for you to look at the chart, or anyone who can get access to your data will not be able to connect to the charts with, let's say, medical record for application, something like that. So you will say that, and the information will be de-identified. And the last part, you will say, I will save this data in a secure manner for, let's say, 1 year or 2 years, and then you will discard this information after we use it as public. If you put this all together, then see if your hospital or your institute has an IRP board that can expedite your application for approval. If they approve it, then you go back to the IT and tell them I have an approval from the IRP and I need this data. They will get it to you. Then we can talk about what the next step.
Okay, good. Got it.
Sounds good?
Okay, okay. Thank you. Thank you so much.
So we have a couple of other raised hands. Oh, maybe not. Iman? Go ahead.
Hello, doctor. I just have a question regarding the AMDA membership. I can see that in the thing that the things to do, there is a link for a free membership. I tried to join multiple times, but it's never free. It gives me always like $410 the membership fees. And I just wanted to ask to see whether there is a thing that I should do, or like there is like a reference that I should write.
So where are you located, if I may ask?
Sorry?
What city, what state?
Oh, in Boston.
Boston, yes. So I think they have their own chapter, if I'm not mistaken, the AMDA chapter in Massachusetts. But in any case, what you can do when you want to register, don't register as a physician, register as a student.
Okay.
And for students, it will be free. So here is the deal. There is a national or US AMDA, and the American Medical Association. This is free for you as a student. And then each state or couple of states, they have their own chapter. So for instance, Massachusetts, they have their own chapter. Michigan, they have. Florida, they have. So if I'm living in Michigan, I will join the AMDA, the national one, and then I will try to get in contact with the chapter of my state, like Michigan State, MINDA, they call it. And I will try to connect with them and see if I can be a member of the local chapter. That gives you an opportunity to help as a volunteer for the local and see if you can get connection and if you can get what we call support so that you can attend the national meeting. There is the annual meeting. Sometimes this local chapter, they have spots or opportunity for fellows or residents who wants to be in the research in geriatric. They pay for them to attend the national meeting. So this is one step further if you want to look forward. But the first thing, apply again as a student to the national AMDA, the big one. And then if you have a chapter in math, try to get in contact with them, see their activities, and offer that you want to volunteer with them, see if you can do anything with them. And then from there, you can get your connection and see what else can be done in your present life.
Thank you, doctor.
You're welcome. Anyone else also can do the same here in the US. I think it's a good opportunity for you guys to go to AMDA the website and see if you can become a member. It's free for students. I mentioned that you are doing your research. I don't think they will ask about your school or status, but they just need a fellowship. If you need a letter, I can write them a letter that you are with us. The next thing, as I mentioned, if you can join the local chapter or and as well. It's going to be helpful for you if you want to volunteer with them. It's an opportunity. It will be helpful for them as well. And then down the road, you can make connections. You can attend their meetings, and then you can attend their national meetings. If you want to present there, it will be a good option. And this will show in your resume as you are interested in geriatric and all that. So
I'm so sorry, doctor. I'm not trying to be annoying, but I just looked into their membership category. They don't have a student in it. They have like physicians, a practice manager, nurse practitioners, and non-physicians, doctorally prepared clinicians, and aligned health professionals and retired.
okay, that means they can't. In the past, at least last year, the year before, the fellows joined as students and it was free. Maybe they changed that. So I will be in contact with you via email and see if we can figure this out. One thing you can do is you can try to send them an email if they have a contact in their website and say, okay, I'm a student and I'm interested in joining your organization and finishing, or I finished my medical school and I want to be part of your organization. How can I join? Something like that.
Thank you, appreciate it. Thank you very much.
Yeah, thank you. Anyone else or any questions? So again, in the coming days, weeks, we can work on a certain part of our resume or CV. So you look at the CV and see what area you want to improve on, and we can set up goals as far as what you want to do. Some might lack some of the clinical aspects, so maybe you can work on getting some experience in this area. Some might be missing some volunteer, so you want to work on getting some work as a volunteer. One of the options, there is Alzheimer organization. They do walk for Alzheimer's. I think it's one day walk. If you go to the website, again, sometimes it's a step by step. So you go there and see if you want to join them during that day as a volunteer. Some other volunteer option is to go through the Red Cross. You want to log into your website. They have also a remote opportunity where you can be a volunteer, let's say for 1 or 2 hours a week. You can just provide medical information, some questions. You can answer some questions and the support for the organization. Red Cross, this is also an option. Or you can do other activities. You can start working on your CV, your personal statement. So maybe you can just write and see if people can review and edit that again. So you will have something ready by the time when you are approaching the application process. Anyone else wants to have anyone with questions or ideas as far as product research? If not, one easy thing to think about is when we write about like the application, there are a couple of options. One of them is the abstract when you send it to the meetings, and the other one is manuscript. This takes some time, data collection, and you want to submit and see if they accept and so forth. But there are other options. Some may write just a reflection story or something like that. Some might write a case presentation. So we can talk about how to write a case presentation in the coming weeks. You can look at what we did in the last year or two in the Telegeriatric Research publication that we had. I'll share with you here. So if you go to this website, we have the publication in the last 2 years. One of them is a case presentation. Yeah, this one. So you can look at this and see how we did it. And basically, when you are doing residency or fellowship, sometimes you might have certain unique cases. So you want to write about these cases. So this is a way how we can do it, and we can practice this in the future. So maybe we can talk about next week. If you have any suggestions, please let me know. I have put some ideas of, so maybe the technical and how team can work on getting the agenda ready. Basically, the suggestions here is the hypertension with Dr. Rayan, Hassan, and Asjad Hassan. Then 20 minutes, 30 minutes presentation, and then followed by maybe we can talk about this article or mobile app and all the others, how we can do a systematic research or evaluation of this. So there is another idea about how to write an answer. So we can talk only about the first 2 sections about how you come up with the title, and then how can you write your introduction, the background part, the idea there. So we have an article or reference for this presentation. Then we can talk more about how you can write your personal statement. I put these names from the list of the team. If you are able to confirm with your leader, if you are unable to mention that so that someone else can make sure we have a good opportunity for everyone. So this for next week. And if you have any ideas for the following week, let's say the red team, they can put their ideas here. So you go to the app and then go to the upcoming Zoom meeting and then select whatever day if you have some ideas there. Any questions? Any comments?
I just got a question. Is it on the 18th or the 11th?
Oh, maybe let's see. Yeah. Oh no, that's off. The date is off.
Oh, okay. So it's for the 11th.
Yeah. So we can do the 11 and then the 18 the next day. This will be the 18th. So I'll keep that clear. Thank you. So it's next week.
Thank you.
Anyone else wants to share or any comments, any questions in general? Your hand is still up. Do you have questions or comments, or that comes before?
Dr. Nadir? Yes, I have a question.
Oh, sure, go ahead.
Yeah. About, you mentioned something about personal statement.
Go ahead.
Yeah, I would like to, to get advice about this. I'm currently stuck with this personal statement issue. So I want your advice on it, how to, if anyone of the team or previous fellows or yourself can give us some guidance about this. Thank you.
Excellent. So I see Sumi is still here. If maybe she will. So if you have a minute, you can look at the email from Sumi for today. Shoot her an email and see what exactly your ideas, what exactly your variables she will guide you through. And then if you need, you can also email me and we can take it from there.
Thank you. Thank you so much.
You're welcome. Thank you. Excellent. So any other questions, any other comments before we end the meeting? Again, if you have any questions or any comments or any suggestions, please send me an email or text me. I'd like to thank all the presenters for today, and thank you, Dr. Afrah, for the Zoom meeting. Thank you, everyone, and I wish you all the best. Have a wonderful day. Assalamu alaikum.
Thank you so much, Dr. Nader.
Thank you.
Thank you.
Thank you, everyone.
Thank you so much. Thank you.
Thank you so much, Dr. Nader.
Thank you so much.
Thank you, Dr. Nader. Thank you, Dr.
Thank you,
Nader.
Dr. Nader. Thank you, everyone.
Thank you, Dr. Nader.
Thank you.
Thank you, everyone. Thank you, Dr. Nader.
Thank you so much.
Thank you.
Appreciate it.
Have a wonderful night. Nice weekend.
Thank you, Dr.
Thank you.